Hi, this is Ryan Urban with Alpha Financial and Tax, and this is a quick look at your Medicare insurance options. Alpha Financial and Tax is a full-service financial services and tax planning firm. We're right here in Colorado Springs. Our office is 719-358-7116. My cell is 719-659-9190. And you can reach me also by email at rurban@alphafinancial123.com. Very quickly and very importantly, this presentation is for informational purposes only. Alpha Financial and Tax does not sell Medicare plans, although we work regularly with our clients to go over their options, because your costs, your healthcare costs in retirement are a very, very important part of your retirement income plan. And so we work closely with you to make sure that you're choosing the right plan for you and for your budget. I'll tell you, there is one misconception more than anything else when it comes to Medicare, and that is that people say, well, I have Medicare, so I'm covered. Well, yes and no. If you have Medicare, you have coverage, but you're not fully covered. So we're going to kind of go over that for you here. First of all, the ABCs of Medicare. Part A, Medicare Part A is for hospital stays. Now, this is the portion of Medicare that you've been paying into during your working life, and so there are no extra costs, monthly costs, to pay for Medicare Part A. When you sign up for Medicare, Medicare Part A is going to be the default coverage that you have. And we're going to get more into that here in a minute. But that is your main Medicare coverage. Medicare Part B is for doctor's visits, and you have to pay an extra premium for Medicare Part B. And as of 2022, your Medicare Part B premium is $170.10. And that's going to be required for more coverage, and we'll get to that here just in a second. If you are a high-income individual, you actually have to pay a higher Part B premium. But for a vast majority of people, your 2022 Part B premium is $170.10. Now, here's Part C. And really, you have two choices here with Part C, and you can either get a Medicare supplement, also known as a Medigap plan, or a Medicare Advantage plan, and we'll maybe call that an MA plan. Well, why do you need that? Well, look at that. Look at the word right after Medicare supplement, Medigap. Medicare Part A and Medicare Part B both have significant gaps in coverage where you're having to pay out of pocket for your care. And these are not insignificant gaps. Plus, regular Medicare coverage does not have an annual out-of-pocket maximum. In other words, if you have a really lousy health year, you can just keep paying to Medicare. So what Part C does is it helps you either completely fill those gaps or at least largely fill those gaps. And we're going to get quite a bit more into that here in a few seconds. Finally, Part D is the prescription drug plan, also known as the PDP. I may say this again, but one thing you're going to have to look at very carefully when you're choosing a PDP, a prescription drug plan, is that company's formulary. A formulary is specific to any given insurance company, and it essentially goes over a couple of things. First, what drugs are covered. Not all drugs are going to be covered. And secondly, at what level. So, for example, if it's covered at a preferred level, you're going to pay quite a bit less for it than for a non-preferred level. Well, Company A may have that as a preferred, Company B may not. So you're going to have to look at the formulary or have your professional help you look at the formulary to make sure you're choosing the right plan. Now, you can go in one of three ways with Medicare. First of all, you can go Medicare only with a prescription drug plan, and you have to have a prescription drug plan, and if you don't, there's going to be penalties. Now, rarely is this choice taken, but that is your first choice. Your second choice is going to be a Medicare supplement with an added prescription drug plan. Medicare supplements do not cover prescription drugs, so you have to get a drug plan additionally. And we're going to go over the differences between a Medicare supplement and a Medicare Advantage plan. Your third choice is a Medicare Advantage plan that does include a prescription drug plan. Now, as I said, for the most part, we don't do number one. Medicare only with a prescription drug plan is not really typically done, so we're not going to really cover that for the purposes of this quick presentation. Okay, now there's not going to be a test on this, but I want to show you that there are a lot of gaps here in what basic Medicare covers. For example, the Part A, remember I told you, is inpatient hospital. Well, there's a deductible for that per benefit period, meaning every time you need to access Medicare A, there's a $15.56 per event deductible. If you go into the hospital, the first 60 days have no charge, but then 61 through 90, you're paying $329 a day. Days 91 through 151, you're paying $658. And after 5 months, you're paying all of it. Part A, and then your skilled nursing facility is also part of Part A. Days 1 through 20 is no charge, but then days 21 through 100, you have to pay. And then Part B, remember, that's your doctor visit coverage. That has a deductible on top of the monthly payment you're making for your Part B coverage. And that has an annual $233 deductible. Then after deductible, for both A and B, Medicare is paying 80% and you're paying 20%. Well, 20% of what? And that's a very important question, because Medicare costs are much, much lower in terms of charges than if you're paying through an insurance company. What that means is there's something called a Medicare approved cost. So, for example, you might have an MRI done. Let's say it's $3,000 if you use an insurance company. Well, the Medicare approved amount that the doctor gets might only be $400. So you would be paying 20% of that $400. Well, why is there so much of a difference? Well, that's just the way Medicare is, and that's why most physicians who take Medicare don't take Medicare exclusively. They have to carve out a part of their practice because they're making a lot less with Medicare patients. So they may only say, well, I'll dedicate, 10% or 30% of my practice towards Medicare, because they're not making nearly as much as either cash or insurance. So again, Medicare supplements and Medicare Advantage plans are made to fill in the gaps of traditional Medicare coverage. And we'll get more into that here in a second. Let's begin with Medicare supplements. A Medicare supplement is essentially made to fill in most or all of the gaps left by original Medicare. So that long menu, all those numbers I just showed you, are essentially covered over by your Medicare supplement. Now, as I mentioned, you must also purchase a prescription drug plan along with your Medicare supplement. So typically, a Medicare supplement generally costs, depending on the company that you use, $150, $175 a month at age 65. And then prescription drug plans will cost between $40 and $125. And the differences there is going to be, the more expensive prescription drug plans might have better formularies or lower deductibles or everything else. So you kind of have to go through it. And the good thing is in this way that, you can choose a prescription drug plan that fits you, your budget and the kind of drugs that you take, better than any others. Another nice thing about Medicare supplements is that they don't have a network. So like if you have a PPO through work or an HMO, well, they're going to have a network that will cut down the amount of options you have for docs. Well, with a Medicare supplement, there is no network. You can use any doctor that accepts Medicare payments. Now, that's another issue because you have to make sure that doctor is seeing new Medicare patients. Remember, I told you they may only carve out a certain percentage of their practice for Medicare patients. So a Medicare supplement covers a great deal and most of the gaps. Now, here's a Medigap benefits chart, and these things are standardized. So plans A through N, A through Nancy, they all have the same coverage. They're all standardized. And the only difference is going to be which company you use. And the premiums are going to vary quite a bit from company A to company Z. So it's always good to shop around and make sure you're getting the best price. Now, there is one plan that is used more than any other, and that's plan G. And more than likely, if you talk to somebody who is offering Medicare supplements, they're going to show you plan G, and I agree with them. I think that G is the best plan. It gives you the best overall coverage. I do believe F is being phased out or changed. So G now is the one that is more than likely going to be best coverage. However, remember also, you're paying for it. So you're paying $125, $150, $175 a month, depending on the plan or the company. But more than likely, if you're doing Medicare supplements, you'll be looking at G, and it's going to, so if you go to the doctor, there's no copay. If you go to the hospital, there's no copay. If you have physical therapy, Medicare approved physical therapy, there's no copay. So that's what you want. It keeps things nice and simple. However, you're paying quite a bit more per month. So you have to budget, anywhere from $200 to $300 a month for your Medicare supplement plan. Okay, those are Medicare supplements. They cover the most. Medicare Advantage plans are very different. Medicare Advantage companies are paid a monthly figure per member. It's called PMPM, per member per month, by Medicare to take over the administration of your health care. So they are now your Medicare. Okay, so the Medicare Advantage companies, they take over the whole thing. Now, these are different. They function much like a workplace HMO or PPO. And so they're going to have a little copay if you go to the doctor or for treatments or for hospitalization. If you go to the doc, it might be $20. If you go into the hospital, it might be $125 a day for the first 3 days. But they have to show you all these numbers before you make any decisions. And every plan is going to be a little different. They do have a network of doctors. This is how they keep their costs down. So you need to check and verify if you want your doctor. If your doctor, for example, then is not in this Medicare Advantage plan, but it is in that one, and you want your doctor, you love your doctor, then you go with the one, or you may go with the one who has your doctor. The PDP, the prescription drug plan, is usually built into the plan at no extra charge. And remember, the government is paying, Medicare is paying your insurance company to take it over. And so it's all going into one place. And most of them, if not all, will include extras like a YMCA membership. And don't sell that short. As we get 65, 70, 75, 80, it's not a bad idea to belong to a Silver Sneakers membership at your nearby YMCA to keep you young and to keep you flexible and to keep you strong. And I'm a big, big believer in that. Now, because they're paid a monthly fee by Medicare, their premiums are usually very low. In fact, they start at $0 per month. And if you live in Colorado, there are many counties that have $0 plans. Your premium is zero, and you get everything I just mentioned, the drug plan and all the coverage. Okay. Now, something to consider, though. Now, here's a negative or a potential negative. If you want to later move from your Medicare Advantage plan to a Medicare supplement, you will probably have to qualify via health underwriting. In other words, you're going to have to answer some questions health-wise, because the Medicare supplement plan is taking on more risk, and so they may say, well, you're a little too sick for us, and that's possible. So you got to keep that in mind with your Medicare Advantage plan. So the Medicare supplement is more like everything is covered, but you're paying more for it. With a Medicare Advantage plan, it's more like pay as you go if you go. Now, the prescription drug plans are offered by many companies, and the variables are, first of all, the formulary, as we discussed. What drugs are covered and at what cost? And you're going to know this going into it. So, again, if you have a good agent, make sure you do. they're going to walk you through. They're going to ask you, well, what drugs do you take right now? And then you're going to go through it and you're going to figure out, well, okay, this is how much this is going to cost me per month. Deductibles. Some will have deductibles, some will not. And then, of course, each company will set their own premium. So again, it's good to shop around. So let's look at these side by side. A Medicare supplement versus Medicare Advantage plan. With Medicare supplements, the strengths are it covers most, if not all, of holes left by Medicare, such as deductibles and copayments. It keeps it nice and simple. They don't require a network, so any doctor who takes Medicare and is accepting Medicare patients will be fine. The weakness is it does not include a prescription drug plan, so you have to add that. And the total, then, the premiums are going to be higher. So $180, $225, $250, just depending on the plans that you choose. On the Medicare Advantage side, the strengths is they include the prescription drug plan. The premiums are much lower. So as I said, it's pay as you go if you go. So you may have a $0 premium, but you're paying, $20 if you go to the doctor. You're paying if you go to the hospital. You're not paying nearly as much, but it's like a PPO or an HMO. The weaknesses include co-payments and co-insurance for most services, such as $20 office visit or a $500 hospital visit. You have to utilize a PPO or HMO network, which will generally require referrals or some kind of permissions. And then you must qualify for health underwriting if you later want to change to a Medicare supplement. So you can start with a Medicare Advantage plan and then later go to a Medicare supplement. You just have to qualify. If you start with a Medicare supplement, you most likely will not have to qualify for a Medicare Advantage plan down the road. This is what the Medicare.gov site looks like, and it's very simple. And I'm always available for help. And as you know, we meet online, we meet in person. I can help by phone. But you're going to start here and go to Medicare.gov, and you're going to click on Find Plans. And it's going to do things like ask you for your zip code, because these plans are all created within a county. So Colorado has 64 counties. There's going to be 64 plans for each insurance company, just to keep this as complicated as we possibly can. But that's where you're going to begin, and you'll be able to look at both Medicare supplements and Medicare Advantage plans. The Medicare Advantage plans are much more specific on the Medicare.gov because each plan is going to have different, premiums and co-pays and all this stuff. So the Medicare supplements are more straightforward, but they'll give you information on Medicare supplements and Medicare Advantage plans, and all you got to do is start there. If you have any questions, contact us. Once again, Alpha Financial and Tax. We're on Centennial Boulevard here in Colorado Springs, and you can reach me directly on my cell, 719-659-9190. Thanks for joining us. We'll see you later.